We're looking at the ankles and feet and how people can go through normal gait and whether they're complaining of ankle pain, knee pain, hip pain, lower back pain, and in some instances upper trap pain. And I could bet you that there's a correlation between that upper trapezius and his ankles, because he's got something crazy going on with his midfoot. And you'll probably see this with a lot of clients, that you'll have one foot that's got a massive supination and the other one that's not as supinated. Now there's a couple of ways we can address that. We can have a look to see if it's the midfoot, the cuboid muscle that is cuboid bone, that is being locked up, and that's because of the torque or the pull between the tibialis anterior and the perineals that come down and meet down there. So they can draw up that foot arch. Or we can have some stuff going on with the navicular head and the talus bones. And it can be one of those two that create a problem. And we're going to assess that right now on the table. So I've got Greg on the table now. I've had a look at his walking, his gait, and I've had a look at the way he can bend and flex to see if his soleus muscle, which is only a one joint muscle, or his gastrocnemius, which is a two joint muscle, if either of those are playing up. And they're not too bad, which makes me think I'm coming back down to the joints again. So I'm going to lock up the hind foot and put my hand on that free floating forefoot, and we're going to try to feel to see if we can get an unlock of that tight cuboid joint. So we're moving back and forward, and quite often it will feel like they'll feel like a click, or sometimes you'll actually hear a click. Now he actually feels quite good there, so now I go to that second point and I wonder, is his foot rotated into that supination and allowing more of the bones, the navicular head and the talus, to be poking out on that anterior lateral angle? So I'm going to palpate, and sure as eggs, I can feel that bone sitting out a little bit more anterior towards me. So I'm going to pop both thumbs on it, and I'm passively going to rock his ankle into some dorsiflexion while he grimaces quietly, because it can be quite uncomfortable. How's that feeling?
Quite sore.
Yeah. So we're going to rock that for about 30 seconds. And then I'm going to get him to get up and go for a walk again, and we're going to see what changes that we had, not only in his ankle, but into that trapezius as well, because it can affect that entire lateral and posterior chain. So I've made Greg go for another walk again, and sure enough, the foot feels easier through that walk. Yeah. Okay. Tell me, what's that feeling like in that upper trapezius?
Yeah, my shoulder and my traps feels a lot more released, and it doesn't feel as tight, and I can move my neck. It's got a lot more better movement.
Yeah. So please don't think that you have to work at a specific area to get a great result. In this instance, that trapezius, which still needs work, has had a lot of release because we've worked through that entire lateral chain.
You have clients and patients that come in to see you that have recurring tightness in those upper cervical muscles, especially the ones along attached near the skull. We call them our suboccipital muscles, and they're the ones that our patients will say, these are the muscles that are really, really tight, and it doesn't matter what I do, nothing seems to relieve them long term. We can do a lot of work as neuromuscular techniques, we can do muscle energy techniques, we can do glides, we can do joint capsule mobilizing. But this is something that's a little bit more global, and something that I've found in the clinic that has got a little bit more lasting length with the client and patient. First thing, let's do some assessments on Kristen. We're going to look at her upper cervical range of movement. So I'm going to get you to chuck that chin out forward for me, and we look to see how much range she's got here. So that's actually extension of the upper cervicals, and then she's going to come back, and we're looking at our flexion. So we need to see good quality, nice length, and there's not a lot there. Go forward again for me, Kristen. She's actually tilting up more than being able to come purely forward and back. And we know that we need to have good range so their eyes can sit at the horizon. Otherwise we have postural anomalies that we'll get going on with our patients. Because we're doing something global, I also want to see how her flexion looks in seated. So can you go forward for me? So we're going to curl down. And I'm looking at the quality. She's got beautiful quality of her thoracic spine. But when we come down to this lumbar area, can you see how it's quite flat here? Where are you feeling that?
Right here.
Okay, so she's got it just along the gutter on the right-hand side of all the way down the lumbar vertebra. Let me show you how I've been getting great results with it. The first thing we need to do is, again, do some passive assessment of the cervical movement. So I want to actually teach Kristen that I'm after some movement like this. So we're trying to get your chin to create double chins. Perfect. And when we go through this range, that you want to feel that your head's driving down to the table and your neck feels like it's going to be flatter near the pillow. I'm going to get you to bend your knees and put your feet flat. What we're asking her to do is create a bridging move. So she's going to engage the gluteus maximus. She's going to get those big power driver buttocks muscles to bring her hips and pelvis off the ground, and she's rotating and creating more flexion through the thoracic and lumbar vertebra whilst I do a traction. So I'm tractioning her up first. We're increasing the drag along the whole, yes please, paravertebral erector spinae group, and she's up in that position, squeezing those glutes for 5, 4, 3, 2, 1, and then she's rolling down bone by bone, starting with the thoracics and then going down to the lumbar, and I'm taking the pressure off the skull. So I'm going to traction in again, pulling in as she rolls up. Really feel those glutes engaging. Squeeze nice and firm. I would say we're even getting some lovely stretches all the way down that thecal area and coming down. So all those lovely craniosacral therapists, this might be a wonderful, you might be able to explain it a little bit better through that line than I, and up we come again. Keep that head down as low as it can towards the pillow. For 5, 4, 3, 2, 1, and down we go. How did that feel?
Good.
Yeah, not too hard to do? Great, excellent. Let's have a retest and see what her neck and her lumbar ranges are like. Kristen, I'm going to get you to go through that chin forward position for me again, and then chin back. And forward. So that actually looks like it's starting to get a bit better glide. How's that feeling to you?
Better.
Yeah. Okay. Originally she was complaining that she had some tightness up on this top right. Has that eased off a bit?
Mm-hmm.
Great, excellent. That's good news. Let's have a look at her seated flexion. Oh wow. Yeah, okay, so can you see the curve change now? That was flat from here to here before. You can do a rewind on this to take a look, but that curve here is beautiful and that's great as well. How's that drag in here?
It feels a lot better.
Yeah.
Less pull.
Okay, so we haven't cleared it completely in 3 moves, but we've certainly recognised that there's a problem. You can come up now. We've certainly recognised that there's a problem all the way from the neck and down through the spine. Use this for any clients that have that chronic tightness up through here, and I dare say anyone who's got lower back problems, that you might be able to do this to assist with lower back by acknowledging that we can work on the skull as well. I'm Paula.
What we've been seeing is clients that come in with really restricted neck ranges and quite severe lateral cervical tenderness, and we can do a lot of work in with the neck, but what we actually want to do is we want to find out other ways that we can help them with homework, with maintenance, and how we can look more distally at things that are going on that will make changes proximally. So with our clients, thinking about our superficial and deep front and back arm lines, the webbing of the fingers all the way through here. We're picking up the connective tissue through the fascia, through our carpal tunnel region, along through the front arm line, and there's a little bit of tension here. You do landscape gardening, yeah? Yeah. So there's a lot of extra arm work that's going on here, and we're going to have a look and see what we see in his range of movement. So can I get you to do some lateral flexion for me? So turn your head to one, drop it down to one side, and I can see quite tight bands through here, and that range is quite poor. And my way? I think this way is actually worse, isn't it?
Yeah, it's quite sore there.
Okay, and back to centre. Look as far as you can over that way. You can see he's kind of trying to cheat and come around because there's not much movement through here. And then my way. A little bit better, but not fabulous. And then back to centre, and then tucking the chin down, which is great. We should be able to get 2 fingers or more down there, and he's nailed that, which is, you got to get 1 right. You can't be a complete dead in the water. Head up all the way. Yeah, and he's got great range and extension. So we want to make sure that we can get changes in our laterals and our rotation. So right now I'm going to grab some great lubricant because we want to be working through the webs. So a little bit of lubricant. I'm just going to put this on my fingers so that there's not too much discomfort through this range. And really simply, just relax your arm down. We're just going to take my fingers and thumb and draw along through the webbing. So down through there 2 or 3 times. And then the same through each of these webs for this, where they meet up the metacarpals with the phalanges. How's it feeling?
Good. It's tight at the moment.
A little sore?
Yeah, a little sore.
A lot of people will do this to them and they'll be like, oh my God, that's really tender. So we've gone through one arm. We're going to have a look at the other. Now, I've worked on this without touching anything with Greg's neck, and quite often I'll have same thing, clients that I've just been having a bit of a test on to see how much change we get. And it's been really quite dramatic, and I'm hoping it's going to be really quite dramatic here too. Let those fingers relax. Try to make sure if they're doing this to allow the whole limb to feel nice and loose while you're running through those. All right. Let's try again, shall we? I'll get you to do the laterals for me, so dropping your ear down. Any easier?
A little bit, still quite tight.
And the other way? That looks...
That feels a bit better.
Yeah, that looks better. Looking that way for us. Lots further.
That one opened up.
Yeah, and this way?